stakeholders, community members, and mental health professionals to be there.
Too often, advocates say a call for help ends in a life lost when police are dispatched to a mental health crisis.
They end up giving them bullets instead of the care and the compassion that they need. And we saw that here in our community with Michael McIntyre. We've seen it with Joseph Mann. We've seen it with Gabby Navarez. And it needs to stop.
Dr. Corrine Sacco, a licensed psychologist of 25 years, says in her review of wrongful death lawsuits against the county, at least 15 people are killed by officers during a mental health crisis each year.
Mental health should be handled by mental health professionals.
Last month, the county proposed a $1.6 million pilot program that would create a mental health crisis call center, separate from 911. It would have been staffed by 5 counselors and 4 two-person response teams operating between 9 to 6 p.m. But after pushback from community members, it's back to the drawing board. Community members at this mobilization event say they are petitioning the Board of Supervisors to shape the 911 alternative free of law enforcement.
It might be that 911 has always been a good experience for them, but that doesn't mean that they should ignore those of us in the community that haven't had positive responses with 911, that don't feel safe calling law enforcement.
According to the County Department of Health Services, a 24-hour call center and 12 mobile response teams of 2 could cost about $11 million.
We want funding to come from the bloated Sheriff's Department budget. We want an independent advisory board that consists of consumers who are the real stakeholders of these services. And we want law enforcement out of the equation.
Well, the Sacramento County Sheriff's Office says it supported the previous pilot program, but we have not gotten word on the department's input on these new considerations. Again, that will be discussed tomorrow at 9:30 during the Board of Supervisors meeting.